Hello. So, thanks again for joining, guys. Today's listener submitted question is a broad question, but a question that I get all the time. So, the main focus of the question was my dog is acting normal, doing good, doing great, but our poop is different and has changed. And to the owner's knowledge, nothing else has changed. They haven't changed the food or anything like that. So, here we go. So, great question. It's a very common question that we get. It's a little bit of a loaded question, so bear with me on it and just realize it's medicine and it's just not all cut and dry. So every doctor is different. For starters, everybody's experience is different, and depending on where you are in the country and all kinds of geographical factors, environmental and seasonal and things of that nature can play a role. In today's world, there are so many different over-the-counter foods and things. I have my preferences with grain-frees, and I'm not a big fan. There's a lot of vets that aren't. Do I think there's a place? Yes. All I'm getting at with that is there's a lot of different foods that are very different than the traditional foods where we had solved a lot of problems, and then just manufacturers and various people wanting to get a piece of the pie, create their own food, put it out, and you get a buffet of dog food or feline cat choices in the pet aisles everywhere, because every major manufacturer is trying to get a piece of the pie, because just realistically the pet food industry is ginormous as far as market cap. So variables within that also. So my personal opinion and preference, generally if the patient is acting like themselves, they're eating, they're drinking, they're peeing, they're pooping, they're playing, doing their normal behavior, I'm not too worried about it. There are nuances within that. Certain breeds are predisposed to certain things. I do have variations within that overall summary, but that's kind of the general concept. So, if we haven't had any table food, that's a big one where we see it. If you have cats, that's another big one where a lot of dogs will get into cat poop and cat food. Those are both very rich and fatty and can be very irritating to the GI tract, and those can be on and off intermittent reasons to explain GI upset or diarrhea. Parasites is probably another common one. Some of that depends on where you're at. Lots of variables there again. So, like I said, depending on our age, as they get older, cancers do get higher on the list. There are GI deficiencies. There are foods that create other problems, like the grain-free things. Some of those, we eliminated those problems, and then changing the type of calories they get brought back old problems that were basically non-existent. So easier said than done. There's different breed predispositions. Example, German Shepherds and Malamute breeds or Arctic breeds. My goodness, they are just bred to have GI issues. And sometimes we can run all kinds of different GI panels tests, biopsies, ultrasounds, so on and so forth, and get a bunch of unremarkables. So there's always variability. Every client will be different with how aggressive they want to be with it. And like I said, the doctor, depending on their diagnostic capabilities, endoscopies, CTs, comfort with getting GI biopsies or not, varies a lot on opinion and just their experience and what they're comfortable with and not doing. So hopefully that was helpful for you. Not a 100% straight answer, but there's just so many variables that can go based on age, breed, diet, and maybe you're doing your part with the diet, but we'll blame the spouse, they're not, or the grandparents, or you got toddlers and kids and they eat messy and throw things everywhere, and you're doing your best, but sometimes just the family unit doesn't 100% cooperate, or you're next to a school and kids throw things over to your dogs. There's all kinds of variables, but generally, I'm not too worried as long as everything else is good and it's not progressively getting worse. So, thanks again, guys. Appreciate all the support and appreciate all your likes and subscribing. Thank you. That helps us keep going. Thanks again.